Okay, so we have now got an opportunity to get a bit of feedback from various groups. I'm just looking at who can go to. Sorry, I'm now in a different view, which I can't see everybody, which is difficult. I shall just go back to gallery. Thank you. So I think we said if you have a volunteer, so I volunteered Afia from my group. Sorry, Afia, do you want to go first? Just give a bit of feedback on the key things that we talked about.
So we looked at the question that was asking, in regards to your first NQP role, how will you ensure that you're reflecting a good understanding of a diverse population that you may work with? And some of the ideas that we had in our group was that it would be important to research into the client group that you might be working with so that you have a good understanding.
You pressed mute by mistake, Afia. Do you want to?
Sorry. Sorry, I'll start again. So we were looking at the question that was, in regards to your first NQP role, how will you ensure that you're reflecting a good understanding of a diverse population that you may work with? And so in our group, we talked about how it's important to actually research into the client groups that you might be working with. For example, if you go to a specific organization and you know that you'll be working with a specific client group, it's important to research into it so that you have a good understanding. Also, there was mention of resources on the RCSLT website. So that includes anti-racism resources. We also mentioned that it's important to go in with an open mind and to not make assumptions or have preconceived ideas of what it might, what might be involved in working with a certain client group. So that's also really important. And then another question that we looked at was thinking about a service or clinical area that you might want to work in. How would you ensure that your assessment and intervention are inclusive and would enable you to meet the needs of the diverse population that you may serve? So again, similar thoughts around that, where it's about understanding the needs of that specific individual and not going in with assumptions or preconceived ideas. And that's all I can remember. Is there anything else?
Okay, I think that was really good feedback. So yeah, definitely there's a lot of information on our website. We've been running some workshops. We've got another one in May. So do have a look, but really looking at the ONS statistics about the population, because we were saying, well, you need to know, if you're applying for a role in a certain area, what that population looks like. But as Afia said, not then making assumptions about the person who's in front of you, but getting a sense of need for them to meet their needs, either whether that's cultural, linguistic, or in terms of religious needs. But we were very aware in our discussions that there are people who may not come from a different community or population group, maybe monolingual English speakers, but have low literacy levels themselves. So just being aware of that socioeconomic disadvantage and issues around health inequalities we touched on. So we were talking about, if people have low levels of literacy, how you work with them to provide information in the right way. So that was really helpful. I don't know if I can ask somebody from Megan Shufflebottom's group to feedback, because she's the first one on the list that I have.
I don't think we actually got around to nominating a spokesperson just yet, but there were some really good ideas. So I don't know whether anyone in my group wants to.
Yeah, I don't mind giving a few thoughts. We actually went through all 5 questions. We were that speedy, but I'll go for the first one that we looked at. So the question was, what makes a good team? Can you give an example of how you've worked effectively in a team in the past? And what skills would you bring to this team? So we discussed the idea of it. If you get given that question, you don't necessarily need to relate it to placement or speech and language therapy. You might offer a scenario with an interest or a hobby or a group that you're involved with. And I think that probably gives interviewers a little bit more information about you as a person and kind of, your interests and your kind of strengths and all that kind of thing. But we talked about giving like a really concrete example. So trying to be really specific with a situation that happened and how you worked with a team to overcome it. So How did you negotiate? Did you have to compromise? Did you have to take on board like differing opinions of people within that team in order to overcome that obstacle? So yeah, I think that was it really.
Thank you very much. So I'm going to move on and ask Hardragan, what's any feedback from your group?
I also think we did not identify a spokesperson, but did anyone want to jump in? Perhaps, maybe.
I can't hear anybody jumping in, so I think it's back to you.
Is it back to me? All right, well, so there was a really good discussion. Actually, I believe they got through the first 3 questions before I switched, but yeah, there was some really good.
Was this my group?
Yeah.
Was this us? Sorry.
That was your
I've seen
you
your
want to jump in,
face and I
Lydia?
forgot your name.
Sorry, no worries.
Yeah, sorry. So I was nominated as spokesperson. So I'll use the example of the second question around the IDSI levels. The nurse had basically given a client on a ward a level 0 fluid, and the recommendations had been level 2. So it was the discussions about how you would deal with this situation. And we spoke about how you don't need to just assume straight away that the nurse has made the mistake. Has the recommendations from the SLT actually being communicated correctly with the staff? And has there been an issue with communication? Because of obviously the implications that's happened from not providing the correct fluids to the client, you wouldn't want to just go in there straight away, sort of guns blazing, because that's not going to be effective. That's only going to make the nursing staff sort of quite angry if there's further reasoning behind that. So just communicating with them, discussing what's happened, why they have actually given a level 0. Is that because they haven't been told to give anything else? And just sort of provide an explanation as to why you've actually made them recommendations, so that they've got further understanding as to why it's quite important that recommendations are followed, to just sort of see where the miscommunications happen, so that it doesn't happen in the future.
Thank you. Is there any other team that's desperate to put their hands up and offer some reflection? We've got 2 minutes, so I'm just going to go through. So I'll leave this for anyone to step in, give some feedback.
Our group did the similar question about the IDSI group, the IDSI question.
Yeah.
I think I was in room 21, and we had a similar thought really, that it's probably a systems problem, as opposed to an actual sort of poor clinical decision from the nurses themselves. And we thought it's a good chance to kind of think about education and sort of how to correct those mistakes at a systems level, and also just kind of maybe check that everyone actually knows what the IDSI levels are and how to prepare them and things like that. Maybe like you could run an event, like have everyone make and drink thickener, so that it's not just a chart that they're looking at, it's like something they've done themselves and drank. Things along those lines. Even though the sort of initial reaction when you read the question is sort of kind of, how dare they, what a silly thing to do, and then you realize that actually, if you've spent any time on wards on placement or anything, it's quite easy to see how it's almost definitely not going to be one individual's fault.
Okay, thank you so much. Thank you, Daniel. So 1 more minute for feedback on this. Any other questions that anyone would like to just feedback on? Do jump in, just feel free. Might not be able to see you initially, but there are a lot of you. So
we talked about safety in my group.
Yeah.
We did decide that it was a very broad question, so probably what you'd need to do is apply it to the role that you were applying for. So for example, an IDSI situation is a very specific sort of safety risk assessment type task. Whereas if you were working in community, there might be lone working policies you had to follow, or in a school there would be safeguarding. So all sorts of different aspects to safety that you'd need to consider.
That's really helpful. Thank you very much, Karen. That's really helpful bit of feedback. So we're moving into the final bit, which is a Q&A session with the day's presenters, which we've now got some time for till 12:55. So I know that you've all, been putting in questions during the time, and you might want to, having had a reflection on what you've been told, have other questions that you want to pose. So and if I don't know if the manager panel has any reflections before we start looking at those questions, I'm going to just go and have a quick look at the questions while you have a think. So Sean, Pauline, Sarah, if you've got any sort of final reflections before we go on to the additional questions. No, nothing in particular. Okay, so questions to all the panel members. So just having a look to see what we hadn't managed to get to before. One of the questions was around the view that you might have, I think this is for the managers, about the use of telehealth more as a result of the pandemic. I know, Sean, you said that that's actually how you set up your service. So what are your thoughts on how we might, what advice we'd give to NQPs around that in more detail?
Yeah, it's really been a kind of complete service redesign for us, because we used to do in-person groups, and because of my client group of trans and non-binary people, sometimes it's actually helpful because people feel more secure in their own homes, feel more confident that they don't have to go to a new strange place and maybe face harassment. So we're going to keep lots of the key aspects that we found helpful for telehealth, and we're looking at a kind of a combined approach. So I suppose it's really worth reflecting on the fact that telehealth and the fact that most of the population are now familiar with this brings lots of advantages. So for example, if I'm working with a bilingual client, I can check the language is correct. We know a lot of languages on referral forms are incorrect, so checking that people know what to expect from speech therapy. They might never have heard of speech therapy and be very unsure about what it involves. So kind of going over what happens in assessment and therapy is really helpful. And as I say, I think it's about kind of realizing we've all developed really amazing skills. I mean, I can screen share, I can do quizzes online, and they don't always work, and sometimes we have to go back to I'm reading off a piece of paper, but these are all skills that people have acquired, and as time goes on, I think they'll just become embedded into everyday life. So I think they're a really, really important part of our arsenal in working with people, particularly those who are hard to reach or might have mobility issues.
Thanks so much, Sean. I'm going to move to the NQP panel. There's a question that came in earlier about, and I'm sure the managers might also want to answer this, about what training you've been given to help you train others, because we've talked a lot about the role of speech and language therapists in supporting the training development of other staff, and in fact it's come up as part of the IDSI example of what's the need here. I don't know if any of you who are on the NQP panel can respond to that, if you're doing that already from your own experiences. I'll just open that up.
Yeah, I'm happy to answer this one. So like I mentioned, my service offer a lot of training to other professionals and to support staff too. I kind of was thrown in at the deep end, to be truly honest with you. In my first few weeks, we had a lot of training sessions. So usually they're run by my manager, so another speech therapist, and a total communication lead. and myself. Usually there's only 2 of us that ever run them, so we just choose between us who decides to run them. But in all honesty, it was kind of thrown in at the deep end. I just kind of got involved and got stuck in. So no kind of, I suppose, specific training. It was just a lot of learning on the job kind of as I went along. So yeah.
Any other reflections from anyone else on that question?
I definitely agree that sometimes you do sort of it feels like you're thrown in at the deep end, and it can be really scary, but it's quite nice to have to think on your feet sometimes, and it's good for you sometimes, quite honestly. I go up to a lot of schools and I spend a lot of time speaking to the class teachers and explaining how they can adapt their communication to suit the needs of the children that I'm seeing. And it's really nice to just remember that not everyone has that understanding that we do. You know, we have to explain things sometimes in layman's terms, and that's no harm, because you have to explain things to parents. They're not going to understand any big long words. I really have to try and catch myself and just say, hold on a second, they're not a speech therapist, and just explain it in a more simplified way. I think that's the best thing you can possibly do.
Thank you, Molly. And that links back to one of the questions we asked about meeting the needs of diverse populations, because diversity is quite broad, isn't it? And what do we mean by that? So thank you, Molly, for remembering, you know, the people that you're there to support. Apologies, I now do have a lot of noise going outside my window. So luckily I'm not being interviewed. Well, I hope not. So moving on to another question. There's one about, when do Band 5 jobs generally get advertised? I don't know if there is a general time from Sarah, Pauline or Sean, or is it just at any point in the year? Pauline.
Yeah, at any point in the year is, yes, that's fine. But we do try and look at when people are graduating. We do try and tailor them, but sometimes, you know, you will have to advertise something if somebody leaves, gets another job. And, you know, sometimes the newly qualified practitioners are up against people with experience who are going for a different Band 5 job because they want to change their client group or they want to move somewhere else. So, yes, so keep an eye out at all times of year.
Thank you. There's a question for Sarah. It's about the benefits of working and running an independent practice compared to working within the NHS, and if there's plenty of support in setting up an independent practice. I think you mentioned before that we wouldn't expect newly qualified to set up an independent practice, because and if you're a member of ASLTIP, you also have to be a member of the RCSLT, because we, you know, provide the overall professional guidance for you to practice. Sarah, what's your advice on that?
Yeah, so I think in the first couple of years of working, you're really drilling down your clinical skills and really consolidating everything you've learned in university, applying it. There's so much clinical learning in that period. It would be very, very challenging, I would say almost impossible, to also develop business and strategy skills at the same time. So I would say be kind to yourselves. Yes, do look at independent practice in the future, but you'd need to be very, very competent and confident in your clinical skills. And that does take a couple of years of working, I've got to say, before you even think about what is ostensibly setting up your own business. As I said before, though, there are established organisations in the private sector that do recruit new grads. That would be a route into becoming a speech and language therapist. On the ground, the work looks very similar to my NHS colleagues. We are working in very similar ways. The interventions are really similar. So on the ground, it doesn't look that much different. But in setting up a practice, you are setting up a business, and that takes a whole other headspace. So get your clinical skills drilled down first.
Thank you. So here's an interesting one. What is the best thing for you about being a professional in speech language therapy? That's to any of the presenters. Who wants to go first? I think Sean mentioned how much he loved it.
Yeah, just to say, I've never had a single day that's the same. And I think the fact that I get up going, I wonder what will happen today. And, you know, you're expecting a child or an adult to have a routine problem and then something really out of the ordinary and interesting and fascinating. So I suppose that's the attitude to have, is it's good to have out of the ordinary cases because they'll really challenge you and help you develop your skill. I adore it when I can't guess what's going to happen and there's a new issue and I'm going to learn something from that. I learnt more from my clients than I have ever learnt from a book or a research paper.
That's great, Sean. Any other reflections? What about one of the NQPs? Shabana, Megan, Molly?
I think, I mean, I've only been in my role for a few months now, but I think what I'm really enjoying most is all that theory that I learned, putting it to practice and seeing how it all fits in. I remember in my first few weeks, I came home and like I said to my mum, like, I feel like a proper speech therapist, and it was such a nice feeling. And even things like planning your diary, which you didn't necessarily have the opportunity to do on placement, but it's part of your working life. Just things like that, you come home and you just feel so proud of yourself for how far you've come, especially given that you're all in a pandemic as well. So I think, yeah, take every day as it comes, but I'm really enjoying putting that theory into practice.
Brilliant. Shabana, I noticed you wanted to come in.
Yeah, I was just going to echo what Megan just said. You know, the experience that you've had as students is brilliant because you've got the theory behind you, but putting it into practice is a whole another level, and you will really, really enjoy it. I know at this point, you're all kind of got deadlines looming, and it just doesn't seem like things are coming to an end, but soon they will, and you'll get your first job and you will be like, this is the best job ever, and it's the best profession, definitely. So good luck to everyone.
Thank you. Definitely the best profession. Molly or Hannah, I don't know if you want to come in.
Yeah, I mean, I love seeing my clients make progress. You know, whenever again, I specifically work with children. So whenever I see a child who's maybe gone from not saying anything to maybe using a few words or even some signs to express their wants and needs, it is just so lovely. And you get a really lovely, like, warm feeling on the inside. And it's just, it's amazing. And I just love seeing and hearing the difference that a few little tips and tricks can make to really improve on people's lives. And it is just, it's wonderful. Nothing beats it.
Thank you. I can't see Hannah at the moment on my screen, but did you want to say anything, Hannah? No.
Hannah's unfortunately had to leave, so she's not here for us.
That's why I can't see it. Okay, so I'll move on to another question. So this is an interesting one. You've all given lots of tips, but somebody's asked, what's the one thing we can do to be the best candidate for any job? So is there one top thing you think? So Pauline, I'm going to come to you first. Sorry, that's mean, isn't it? You know, what's the thing that really, have you seen a candidate recently that's really stood out that you thought, wow?
So you can't be the best candidate for every job because every job is not for you. So select. It's really apparent when I interview people where their interest or passion lies, you know, and what client group or doing what. So, you know, pick and choose your job. So there's no one thing, it's the whole package.
Thank you very much. So there's something about, you know, all the things you've heard today. So sorry for whoever asked that question. But is there anything else that Sarah or Sean want to add to that question or that answer?
Yeah, I think we've said it already today, but just to reiterate, it is around good fit. So it's making sure that the organisation is right for you and that you're right for the organisation, because then great things will happen. So ask lots of questions, do lots of research, because when you make that decision, those are the people you're going to be working with.
Yeah, just to reiterate that, I think as well, just consider the client groups as well. I mean, I've had students who have dysfluency. I've had students who are LGBTQ+. I've had students who are neurodiverse and have thought that's going to be an impediment, but then they've gone on to have jobs where that gives them unique insight in order to help other people and families. So they've turned it from a challenge into a real strength. And I asked them their advice, you know, how would this be more easily presented for you with those needs? So I think if you do have an additional need, try and turn it into an advantage that you've got that perspective.
Thank you. So there is a question which I think is highlighting the current pressure points in the NHS in particular because of the pandemic. So this is the managers panel. Are you finding that the opportunity for CPD or to specialise is becoming a thing of the past now that services seem to be so overwhelmed and understaffed? I know this is something we're looking at seriously as an RCSLT. Sean, do you want to go first?
Yeah, thanks. I mean, I prioritise CPD when we're busy. So my team, we had a journal club yesterday. Now, I'm incredibly busy and so are my team, but they felt it was so refreshing, so lovely to step out of work, and then we ended up thinking about how to improve our care pathway. So I think if a manager or a team lead really values their team, you will always see the advantage in investing in you as a team member. And no matter how busy we are, that's my job as a manager to go, I know we're really busy, I know the waiting list, I'm meeting with the commissioners, I'm talking to them about that, but that's my job to take on. It's not yours as a band 5.
Thank you. So there's something that links back maybe to the questions you ask when you go for interview to find out what CPD and opportunity there is to support CPD exist within the service. As we keep saying, you're also interviewing the service as well as them interviewing you. So someone has asked about the impact of telehealth on current staff mental health and what you're doing to take any steps to mitigate this in your various settings. There's a lot about well-being here, isn't there? Don't know who wants to go for that one. Pauline, do you want to answer that?
Yes, so I feel very fortunate. I work in a health board that's got a very strong staff care department, and almost immediately they set up staff rest centres in our acute hospitals. First of all, some of our staff were deployed to work in those staff rest centres and have come back with a massive range of skills in addition to their speech and language therapy core skills. So that's been an advantage. So we're well supported by the organisation, and they have resilience courses and wellbeing courses. But also within our own service, we recognised quite early on that because we were all working remotely, we didn't have the connections that we previously had. So we set up a kind of coffee and chat function, just a kind of informal thing, in addition to our formal check-ins, our formal meetings, where you could basically you go onto the Microsoft Teams channel and go in for a coffee and chat with anybody. And I had a particularly memorable one myself. One of my members of staff used to go in and put a mask on, so you didn't know who you were going to see that day. So we try to buoy each other up and keep it a bit fun, because it is incredibly important, and that's part of teamwork as well, I think.
I think just to jump in here as well, just to echo everything Pauline said, having check-ins, having social things, but also remember the pandemic, I know it seems like it, but it won't be forever. And you might be grateful for a couple of days working at home or a day working at home, and having that flexibility and being able to do lots of stuff. So it's about finding the balance, and I think we will do that as a society, but certainly as a profession, it will add to the ability, when people are, we're a very female dominated profession. There might come a time where you want to plan a family. There might become a time when you want some flexibility. So you'll have those skills. So just store that away for when you need them, because I think, we will be looking back at this time going, oh, it's great actually to be able to do this flexible way of working.
Yeah, and in fact, at our conference, we had a session on teletherapy and telehealth, and there was a speaker from Australia where actually it's more the norm because of remote working, the geographical spread of the population. And, we're very keen to keep developing and learning from that. There is a big push, as you can imagine, with I think we've probably moved a decade in the use of digital now in the NHS, is what we've been told. So we've really leapfrogged. And I think you said earlier, Sean, it actually is supporting some patients who'd find access to services that it's actually helpful for them, because they might find getting on transport, getting to a clinic quite hard and quite inaccessible. So there's something about understanding that it can actually be an advantage. One of the things we're asking all our members to do is to measure the outcomes when they're using teletherapy and telehealth, because it's still quite new. So again, look at our website. We've got loads of resources. I think we've got a webinar on it. So, you know, do see this as a positive development opportunity too. So we've got some quite specific questions coming in. One is around developing additional skills to help you when you apply for Band 5 posts. Somebody said that they're trying to get as much additional qualification and training alongside the degree in areas that they're interested in, like Tavistock training for trans voice, to show that they're motivated in taking opportunities to learn, but they're aware of pigeonholing themselves or seeming like they're saying they're more qualified than they are, as they're aware they still don't really know anything at the beginning of their learning. And someone else is saying, is there a benefit in learning some sign language? So there's something about, you know, additional skill set, skills development, and how that might come across. I don't know who wants to take that first.
Yeah, so shall I jump in and say, that's attractive, but we're all really aware that the speech and language therapy course is incredibly full on. So don't overcommit, don't overwhelm yourself trying to get all these additional experiences and qualifications. If you have had time, if you've taken some time out, if you've had those opportunities, lovely. But actually, I wouldn't discriminate on applications based on that, because I appreciate how full on the course is.
Thank you. Any other comments? Sean, did you want to?
Yeah, just to say, you know, I'm involved in planning the curriculum for the University of Manchester, and it's really hard to cover everything. You know, we're such a diverse profession now. I talk to colleagues and I think, I have no idea what you do. And it's so fascinating, you know, because we're so far apart in different specialist areas. So I think it's really important to just acknowledge, as Sarah said, that it's a really full-on degree. We can't really cover everything, and you know, we know that there'll be gaps. We know that some candidates will have more experience than others in terms of the, you know, what kind of placements they've had and what kind of learning. And that's why we keep talking about portable skills. You know, if you've run a university society, been part of that, if you run a local scout group, you know, it could be anything. Those are skills that you should really value and highlight. You know, in the group breakout, we were talking about being a team member. I was saying, you know, think about when you're in team, if you're in a local choir. That's, you know, a great example. It doesn't have to be from SLT to start with. We know you're just at the beginning of your journey.
So there's lots of, I think, concerns I'm picking up on the in the chat box about, one is around, can you apply for jobs if you're not registered? Well, you can. If that person joined late, they would have, they may have missed that one of the student NQP panelists said that I think they started their job as in Band 4 as an assistant and then became a 5 when they got their registration from the HCPC. So it's registration with the HCPC, which is a legal requirement, and then membership of RCSLT, because they monitor you against our professional guidance too, which is why joining both is important. So going back to that particular question, it's really then people have talked about when they can start applying, and if it's okay to apply if provider organisations are really desperate for people to come in. So I'm intrigued by that question, and whether, we're pushing for speech therapy services to look at Band 4 roles, and again, the Band 4 to Band 5 could potentially be something that you could talk to services about if you haven't qualified. But I just wonder what Pauline, Sarah and Sean think about that. We're trying to work with the system to come up with some flexible solutions, is all I can say, because we have a bit of a chicken and egg at the moment, don't we? Any comments from any of you on that?
Yeah, we would employ people and wait for them to become qualified. And just recently we've had a few people join us who did start on a Band 4 grade. They were interviewed for a Band 5 post, but started on a Band 4 grade because their HCPC registration hadn't come through yet. So we're pretty flexible. And just to say, we've also actually interviewed and appointed people who were currently on maternity leave and just waited for them to come back. So if you're the right person, you're worth waiting for.
Yeah, to jump in on that point, I've interviewed someone who was expecting and I waited a year for them because they were the right person for the job. So I'm prepared to wait if I think you're going to be a good fit for my organisation.
Thank you. Sean, any other final points on that?
Yeah, and you know, in terms of development posts and stuff, it is all about being the right fit. So everything that everyone's already said, and we really mean it. We've done this throughout our roles as managers. So we're not just making this up. We do this stuff. If you are the right fit, we will wait for you. Absolutely.
Yeah. So I think we've come to the end of this session. I'm very aware that loads of other questions have been pouring in, some very specific. So again, we can come back to you on those. We might not know the exact answer. We know that some of you are still not members of RCSLT. It is free to be a member as a student. You know, we are here as your professional body. We influence into government, into policy, so that people who you see that their needs are then reflected in local priorities. So it's really important that your voice is heard. Our members work with us to do some of that work. Join a CEN, Clinical Excellence Network, really good to help support CPD, which you've all been talking about. And we have a huge range of resources on the website, so lots of information to support you, as well as our NQP CPD diary. So there's lots of stuff there, and really important as being part of a professional community and a community of practice. We have over 19,000 members now across the UK, working across 35 different clinical areas. So I saw somebody asked about working in the justice sector. So again, getting involved in a CEN in that area would help you to think about your career in a particular area of interest. So, you know, I think we've got 100 CENs. So, you know, and we're going to be doing more work to support the development of clinical excellence networks, particularly around the CPD and the pipeline for the profession and professional progression. And there's loads of different career routes. So, you know, just get involved, become part of the RCSLT. You will then know about more about what some of those career routes are, and we can help you in your future. Because who knows where you might end up? You might end up where I am.